bony fusion was there. I showed him on the scan. That was really hard for him to take it down. I think his surgery was like 4-5 hours. Pretty long it was. And he was alone. So, anyways. So you're leaving tomorrow, meaning these sutures will have to be removed in, where are we coming from? Mumbai. So those sutures have to be removed in Mumbai. I can't remove them for you today. These. Because it takes time to heal. That's easy. You can take it off in Mumbai very easily. This splint will remove now. All those sutures inside the mouth can stay. Okay, that's it. Can we get this before picture on the iPad? Done from here to here and everything from inside. And this is compressing the bone so that there is no swelling. So when I remove this, it hurts a little bit. Okay, you can see once where is this, because we're transparent I'm not hiding in removing this and then showing something, right? So directly you can see, and we've actually not done anything for 5 days. Nothing we have done, right? Apart from giving medicines. So see, doesn't happen like that. That you will know when you go and get these kind of procedures. Maybe in Mumbai, maybe in Delhi, wherever it is, doesn't happen easily. These are not that simple procedures. Okay. Right. And your brother has done great research. He had gone to I don't know where all. Everything he had done research, and then after a lot of that. Okay, show me. But don't we have one without his beard? Because we can't show the one with beard. Alright. Can you pass that light for me? Yeah, show me that. Yeah, that one is fine. Just show the, yeah. See the difference now.
Yeah, there's a difference.
Huge difference, right? And look at the lips. Mm-hmm. That's what like a lip folding. So many patients come to me and say, Doctor, I want lip reduction. Mm-hmm. But no, this is not the problem of the lip actually in this kind of cases. And then you see the chin, how it was like that. Yeah. And now you see the nice shape, the broad chin, this height has been increased, projection has been increased. And this is only 4th day. Mm-hmm. There's no bruising, there's nothing. And I'm going to show you inside. Open your mouth a little bit. No. You see the sutures everywhere. Mm-hmm. Can you see that?
Yeah.
All the way till there. Okay. So that's the sutures. Everything is fine. Okay. You want to turn this a little bit? Yeah. Let him have a look. We are all seeing, but he's not having a look. Yeah. Yeah. Show him the view also there. And you see this jaw line also is defined. And it was not so defined before.
Yes.
In this shape, all of that we've got. So what do you think?
Yeah.
It's good?
Yeah.
Yes, it is good. It's very good actually. So you got to wait, and also don't sleep on the sides.
Okay.
Because this is all with plates and screws. It's strong, but if you sleep on the sides, it can move a millimeter maybe. So then we don't want any asymmetry to happen. Sleep straight for 4 to 6 weeks, like this. Don't put pressure on this side or this side. Okay, this was nothing, okay. He had this nasal flaring was there. If you see the picture, just go back. Mm-hmm. Yeah, open just the front view. Yeah, look at that. Mm-hmm. So we are having a surgery, like it's an opportunity to do a little bit or finer work. So I've just narrowed it down. Mm-hmm. None of this scar will be visible after a while. Nobody will ever know anything was done. It's going to be nice and smooth, and the alar work is going to be fitting perfectly. And by doing this tip has also become a little bit more defined. Mm-hmm. That you will see later on once it heals. I've gone from here and just defined the tip a little bit, thoda, just the minimum. Okay, and this nose fits your face also now, because your face is slender and narrow, and a real narrow nose has to be between the eyes. But for our Indians, South Indians, we tend to have broader nose only. So if it's so flaring out like this, that flare, you see, it's coming out of the nose. Can you see that?
Yeah.
That's called the columnar flare. So now you see it's not. Mm-hmm. The most protruding part of the nose is here. Earlier was like a loop. So that's what makes that elegance eventually when it heals up. But we've not taken his racial thing off or done anything major.
Okay.
Now we're going to give him a nasal drop. He has to take antibiotics for some more time. tablet to make sure he doesn't have sneezing or cold or cough, all for the work inside the nose to clear. Next thing, when you take the flight, it can bleed because the septal work was major and it's only 5 days. So we're going to give you some gauze and everything. Please don't panic there, because then it will become an emergency on board. We'll give you a fitness to travel certificate, and if needed, get the COVID report done again. Okay, these many things you do, but the bleeding is something to be careful. If there is any bleeding, just keep the gauze and press it like that. If there is, I don't think there will be anything, but don't let it come down, fall everywhere, and then
Yeah, create a chaos.
they'll be scared. They'll not know what's happening, and they'll call the emergency services, and then you might also want to tell some of the staff quietly as you board the plane that look, this was done for him. In his case, I don't tell this for most of my patients, but because the septal work was so extensive and septum is a very vascular area, and we've removed the pack, and suddenly when the pressures increase, it can just ooze. Okay, it did happen to one of my patients some couple of years ago probably, and yeah, so if you're prepared, it's okay, and then you take the pack and keep it. No need to panic. Even if it oozes a little bit, it usually stops on its own.
Okay.
So all right, cool, thank you.